Coordinating Minister of Health and Social Welfare Ali Pate has announced the establishment of a dedicated out-of-school and Almajiri health scheme to identify and provide medical support for millions of Almajiri and out-of-school children across selected states. Speaking during a meeting with the leadership of the National Commission for Almajiri and out-of-school children in Abuja, Professor Pate emphasized that President Bola Tinubu sees children as its greatest asset and is determined to invest in their future. He noted that the government sees health not only as a service, but also as a critical part of social protection that must reach the poorest and most vulnerable Nigerians.
Excellency, the President says children are the future. We need to support them, we need to invest in them. They are our greatest asset. But it's not just about rhetoric. We need to act as leaders at the federal government level, state level, local government level, civil society, traditional leaders, individuals, families, households, to cherish what God has given to us, which is the population that will drive this country into prosperity. We will establish an out-of-school and Almajiri health scheme.
We are here, sir, to ask for your support, and we have a group of prayers, one of which is to assist us, have a data that is cogent and verifiable. And the second issue is to also assist us register those Almajiri to get healthcare services using your God-given office and the praying to God to provoke, the spirit of sympathy in you and the Ministry of Health. Other issues are also contained in the letter which we want to handle.
Well, still talking health matters now, the federal government is set to implement the maternal mortality reduction innovation initiative in 5 local government areas of Ondo State. Minister of Health Professor Ali Pate made the announcement in Akure during the opening ceremony of a 5-day activation workshop for the project. Senior reporter Ayodeji Moradiyo reports.
The Maternal Mortality Reduction Innovation Initiative, launched in November 2024, is a strategic effort by the federal government to reduce maternal and child deaths nationwide. Currently active in 33 states and targeting more than 72 local government areas, the initiative has now been extended to those states in Nigeria's southwest. In this phase, 5 local councils of Akure South, Ese-Odo, Owo, Ondo West and Ifedore are set to benefit. At the opening of a 5-day activation workshop in Akure, the Minister of Health, Professor Mohammed Ali Pate, reaffirmed the government's commitment to safeguarding the lives of mothers and newborns. The minister, who was represented by Amina Mohammed, Director and Head of Child Health Division at the Federal Ministry of Health, said the initiative will improve maternal health in Ondo State.
We want to ensure good population health, and the only way to do that is to ensure that maternal and newborn mortality it crash, so that women can live healthier and quality life to take care of their babies.
The governor of Ondo State, Lucky Ayedatiwa, who was represented by his special advisor on health, Semidele Odimayo, expressed appreciation to the federal government for prioritizing maternal and child health.
It's a national program that is being organized from the federal, but in collaboration with the state, to ensure we can have a workable plan to really bring down the rate of death and ill health among children and mothers. Especially
program, and WHO is always ready to support the health system strengthening, especially when it comes to maternal and neonatal child health.
We are not limiting, this project will be limited to these facilities, but the lessons learned will be used in implementing programs.
The initiative is expected to produce a clear roadmap for the seamless implementation of maternal mortality reduction innovation initiative across the selected local government areas. Ayodeji Moradeyo, TVC News, Akure.